Good morning, honeys. I see you. I am, again, not on top of my game and not getting to work on time. My watch is charging. I am in buttercup mode today in advance of my normal schedule because on Thursday I've got a makeup session with the electrologist to rip out the little handlebar, finish up the lip again, goodness, and then we're just going to rip the chin on Saturday. We'll do a little chin ripping tomorrow, but we're going to just do a big old rip on the front of the chin, and this is going to hurt. It's going to be puffy. It always hurts. No reason not to do it. Shouldn't even say it, to be honest. It is a process. It is necessary, and we do what we do. I found something interesting the other night. Last night, I was going home after hanging out with Dad and having dinner again, and I needed to stop and get a few cosmetics and some hair color, and I couldn't remember what hair color I was, but I think it was L'Oreal 5CB or something, I don't know, brown chestnut something, reddish brown chestnut, I don't know, whatever. I should have taken a picture and put it in my phone. It looked close. I don't know. But I usually use the Revlon Instafix to smack around my face a little and even up the skin tone and whatnot. Cover up the shadow a little. I don't do the whole orange rouge and wow, the creek is actually down. We had a ton of rain. That's weird. Wow, that was a weird thing. Okay, there's an ADHD moment for you. I just completely went off topic so fast it was ridiculous. Anyway, I'll put my glasses on in a sec here, but I was at Walgreens and I got my regular Revlon Instafix big lipstick tube deal, and I looked up and there were little ones, and I thought, well, why are there little ones and big ones? And I looked at it, it was contoured like a little teardrop shape and stuff. And sometimes I put it under my eyes because I have dark bags under my eyes, as most people do. My mom did, my sister does, my aunt does, I do, but more than they do. And I realized it's kind of a male trait. And I was talking to my electrologist about this, and she said, yeah, we have kind of built-in eyeshadow. The problem is it's, the baggage. I'm like, oh, that sucks. So I got one shade lighter than my regular Instafix. And instead of jamming Instafix in there with a great big round, spot and then smearing it around, I was able to actually get it exactly the way I want it and blend it through. And I actually really like the results. So I'll probably always need to get one for my purse now. But I don't know if you can see, it's like it really kind of erased the baggage pretty nicely, and I like that. So anyway, I'll show you my eyes today. Now I'm going to cover them. Eyes are gone, can't see them. So I have hazel eyes, which are I don't know, yellow, green, brown, something, I don't know. Never been very happy with them, but they are eyes. They work and I need them, so hey, it is what it is. I was out with a friend Sunday. We had a really fun time. We just went and did a lot of fun things. We've been talking about all these fun things, and finally we're doing it. We're doing all of them. We're going to go to church. We're going to go get some coffee cake. We're going to go make some candles, and then we're going to go have a really good dinner. So that's our whole day. It was so much fun. So much fun. And just went and we did. We ate. And, such a good day. Just landmark, beautiful day with my buddy, my friend, my bestie. Absolutely fantastic day. And that's kind of the topic we had yesterday, friends and how important friends are and all of these things. Well, today's topic is a little different. I wanted to go over voice. Obviously I'm going to have vocal surgery. Not everybody does. Not everybody opts to go for that. I'm going to, because with the voice that I have and vocal coaching that I have had, there wasn't a lot to be done. Tone was my biggest move. I've kind of been in this tonal range, but not as much, most of my life. And had to be very mindful of it because people would ask me if I was gay. And it became annoying. I don't get asked if I'm gay anymore. But now I am. Isn't that weird? Isn't that just the most ridiculous thing? So, whatever. Oh, so labels. Labels. So with voice, I'm not sure how good of a person I am going to be as far as explaining things to you, but I'll do my best. Mostly what I've learned, but because my voice is rather a unique one to begin with, I don't know exactly if it can be compared to anything else. My vocal tone and quality match my age, which is fine. I just sound like an older female. I was talking to a friend of mine a while back, and we were talking about the mountain lions out here and the bobcats and such, and how like the Florida panthers have, I think they're extinct now and stuff, and how the certain wildlife is endangered and everything. And he was talking about the eastern or East Coast, eastern cougars population is declining and all this stuff. And I said, yeah, but honey, the western cougars just increased by 1. Stupid joke. Stupid joke. Bad, Jackie. Bad. Don't even know why I said it. That's silly. Anyway, as far as voices go, I think tone is the thing that people should work on, and they all seem to think they need to start with pitch. And I'm noticing this a lot. I was talking on the forum recently and went back to a really old post that somebody actually just like last night, they posted on something I talked about a year ago, and I was like, oh my goodness, I look at that post of mine, and I realized what I'd said was, oh, well, I've been trying my pitch in the car with the dog and the kid, and when it's appropriate, because it's like you can talk like however you want, you can talk goofy, whatever, and the dog doesn't care. A little Harley dog, little wiener dog, I miss him. He passed away on New Year's. Little guy. Loved him. He was almost 19. But I read that post and I saw what I focused about. Pitch. Well, pitch. It's not so much pitch as it is everything else. Cadence and prosody. The way you speak, mannerisms you speak with, the words you choose, and the way that you inflect them are extremely important, but can be characterized as doing an impersonation, I suppose. And it really is to the individual how they're able to accomplish that. I just go back to my speech patterns I adopted mostly from my uncle, who served as my stand-in father. He was gay but not flamboyant and had a speech pattern all his own. Now I've had some of my own with my own female overlay, but again, I'm leaning on some old things that just seem to work for me, and that's fine. I pushed my pitch strictly towards cranial resonance after having some interaction with a speech therapist. And that really knocked me into female. That was it. Pitch is really hard, I can do it. Okay, so pitch is not as hard as you would think. You can do it, but you end up in old habits. And when the time comes and you get back into your old habits, you drop again. And when I get comfortable with somebody and I'm speaking with somebody, I end up dropping back down into my pitch range that I'm comfortable at. So that's why I'm opting for surgery. I'll do my best for the rest of this video, but honestly, it's effort. It's a lot of effort to maintain that. And it affects the way I can think about what I want to say, and I just don't like it. I suppose if I did this every single day, all the time, and stayed, it would be easier. And I do try, and it's been a year now. And I still think that my natural higher pitch, when used, is fine, but it could be so much better. And for me, I want to be able to sing back in the church choir, and I'd like to move into, a range where it's comfortable. Silent night is something that's very important to me, and I want to be able to hit those 3 notes I'm missing right now. So I have a lot of work to do. This is no little deal. I'm not just doing it because it seems like it's easy. I'm doing it because I have this really lofty goal and I'm going to work super hard at it. I've done some crazy physical therapy stuff over the years. It can be done. You can do anything you need to if you'll put in the effort. Let's see if I'm still in pitch. I think I'm still in pitch. It sounds right. So, anyway, one of the things that really makes a big difference isn't pitch so much as it is tone. Tone has to do with using cranial resonance rather than a chest resonance. If you can put your fingers on your sternum and while you're speaking you feel vibration, you are resonating in your chest cavity, and that's a very male trait. You can have the highest pitch in the world and still be resonating from your chest, and it's going to sound male. You can use the pitch you already have and move towards cranial resonance, and it does push into this female tone, just low range pitch female tone. So that, I believe, is the most important thing to work with. Cadence and prosody is going to be up to you, and you'll need to just do a lot of listening. I found that I have to be careful who I listen to. I have a friend that I listened to for a very, very long time, and I started picking up her inflections and even part of her accent. And I had to be very careful not to spend too much time listening to her for hours and hours, even though she's a great friend of mine. If I do so, I start picking up her accent. I guess I'm just very impressionable that way. So, and I say so a lot. So, buttons. And I say a lot. I don't know. And I snort. So, I'm cuteness. Love me. I'm going to take this opportunity in the middle of the video because it's now different. I just remembered. Why don't you thumbs up this video? Give me a thumbs up. Come on. Love me, like me, give me the thumbs up. I'll even growl at you if you do it. So, and, I saw that. Thanks for the thumbs up. And subscribe, subscribe so you can see what's going on, because there's all these fun things happening where I'm going to get sliced and diced and poked and prodded and pulled and nipped and tucked and all these things. So come on, you want to catch that stuff, don't you? You don't want to miss any of it. It's coming fast. 3 months, top surgery's hitting, and then the seat belt's going to be in a weird position and tighter. And what are we going to do out here? What is that going to be like? I don't know. We're all going to find out, aren't we? So, and then a couple months after that, let's go nail the vocal deal. And we can really find out what it's that like. Let's try to tune again because I can hear myself low. Okay, so I've tuned it back up. What I'm doing when I am tuning is I am stepping up towards my highest frequency. It actually forces my larynx higher and higher and higher. And it'll actually, I can push it so far, it clicks. And I don't know why it does that, but I get it way up in the top up here. And even the surgeon for facial was hunting around for my larynx. He said, where is your larynx? Where is it? And he's like, oh my gosh, it's way up there. It's like already in the female place and it's little. So you don't need to have a shave or nothing. So no playing with that. Leave it alone. And he wouldn't even mess with my jaw because it's already, triangle-y and stuff. I'm nice and jowly, but again, it fits my age. So it's all good. Chicken neck. So I just have to sit up better. If I sit up better, I don't have quite the chicken neck. So what I've realized is when I'm tuning, the best I can accomplish is around 700 hertz. I try not to do it too often because it is a strain, but just to get myself up into a tighter vocal constriction so that I'm ready to speak in a higher pitch. Then I maintain the pitch as best I can, and I try to be mindful, but I do eventually get lazy and drop that pitch, especially with someone I'm comfortable with, and then I'm just speaking to them and not thinking. I'm thinking about what I'd like to say and listening to that person and really not paying attention to what my pitch sounds like. So it is what it is. That's why I'm opting for surgery, because it's really mind over matter for me. And I'd rather just use my mind than have to focus on something like that. I'd rather be just natural me and not worry about these other things. It is covered by my insurance, so I see no reason not to utilize the resource at hand. I have a friend who's done it, and she sounds fantastic, and I see no reason not to utilize this wonderful resource given to me by my insurance and my medical providers. Tone is the thing I want to talk about. Cranial resonance sometimes is a bit of a what the heck? How do you achieve this? Well, first and foremost, I will recommend, if available to you, you go to a vocal coach. It's just that's how it goes. A vocal therapist will be able to help you. I can tell you what I've been told, and I've been given a stack of paperwork and pictures of vocal cords and how they work and the difference between cranial and chest resonance. You have to imagine yourself speaking out of your forehead or your nose. For me, it's mostly my nose. I notice that, the bridge of my nose and that area there is what seems to resonate for me. Getting my forehead to resonate takes a lot of work, but doesn't sound right to me. So if I really push it up, if I get it up there that high, it sounds super nasally to me, and I don't like it. So I just prefer, resonating in that cranial area that is comfortable for me and doesn't sound like Fran Drescher. I don't want to sound like Fran Drescher. Yeah, no, don't do it. Not exactly my forte, not what I want. I don't even do a good Fran Drescher imitation. But if you want to experience cranial resonance, do your best Fran Drescher, imitation. So if you want to have an instant oh my gosh moment and you have been unable to achieve that, go listen to Fran Drescher for a while and then imitate her. Do an impression of Fran Drescher for a while, and you're going to get that very, very definite cranial resonance. You can't possibly not. Do her laugh and you're going to have cranial resonance. But at least that, while you don't want to do that on purpose, well, I don't know, maybe you do. Maybe you're from Jersey and that's just fine and good for you. Not for me. Not for Jackie. Jackie doesn't want it. So if it works for you, great. But I know that that's one of the tools that seems to work. If you have no idea who Fran Drescher is, she was an actress in the 80s who did a show where she was a nanny, and she was like a Jersey girl, and she had this very nasally, high-pitched kind of mannerism to her voice and a very unique laugh. And should you decide to imitate or do an impression of that, you're definitely going to be nailing cranial resonance. And you will notice that you can put your fingers on your sternum and not feel any vibrations whatsoever. And that definitely will give you a clue as to what you need to do with your muscles during speech to be able to move into a cranial resonance. Hopefully that's a bit helpful for you. I really go more with the idea of doing an impression than I do trying to explain to you the ins, the outs, the anatomy, and all of those things. You will also notice that your larynx moves up pretty dang high when you're doing that. And, strengthening the muscles to do so is kind of important, and singing is good for that. I would sing in the choir for years and years, and that was good training for me. So I really want to go back to singing in the choir. In fact, I really want to go and find the chords to my Xbox and get Rock Band so I can sing along to all the stuff. I love that. It's so much fun. I love doing rock band. So hopefully that's helpful in some way, and I've given you some advice that's useful on voice and pitch. So good luck to you on all of that. And remember, this is about support, and should you find yourself needing emotional or mental support about what is happening in your life, and it's resolved to you to be moving in this direction, you're trans, you know it, and you're doing your best to find the resources to support yourself, there's a great one out there. Transgenderpulse.com has therapist resource listings in your area that you can find on their resource page. And if you're struggling greatly, they have suicide hotlines. I find that the first thing, the most important thing, the thing that really worked for me was finding a therapist. I was really going down the rabbit hole, and the therapist was the thing that I needed more than anything to be able to accept myself and discover the things that were necessary within myself to move forward and find a pathway that was going to work for me that most likely should have happened long, long ago. One of the people on transgenderpulse.com befriended me rather early on in this process, a very dear person who I need to call and speak with. I just haven't done so lately because I am so overwhelmingly busy in so many ways. But I'm going to do that soon. And I know that she does occasionally like to watch the videos. So, hey, one of these days we got to hang out, go to dinner or something. And she is a fantastic race car driver, although I guess she's not going to race this coming season. But I can see myself really like hanging out in the garage with her and just talking gears and grease. I get it. I'm a total gearhead Jackie, so we could talk about Volvos. But at any rate, the people on that forum, again, I experienced fantasticness with friendships and being able to get support, pouring my soul out, and having people just absolutely find ways to lift my spirits, or at least inform me that I'm not alone. And I want you to know this. You're not alone. This is something that a lot of folks have to go through, that they need to experience in order to move forward in their life. You are not by any means on your own, and there are those out there who are wanting to support you, and that is a good place to go. Everyone has their own pathway, and everyone has their own needs and goals. Everyone's a different person, but you will find so much support there. I recommend it. Take care of yourself. Hopefully you have a middle of the week productivity boost and feel good about yourself. And just remember, I care deeply about the things that are going on with you. I really know how difficult it is, and I'm hoping to share as much as possible so that you can understand you're not alone and you can get through it. I've been through the ringer, and I continue to put my head right in there. So just watch along and keep with me for a while, and you'll realize, oh my gosh, poor Jackie, she's doing okay, but wow, and maybe by comparison or through some of the things that I share, you find similarities that make you understand things will be okay. It's a matter of going through this process and spending the time, and it is a long process transition. So if you have the fortitude to live, you have the fortitude to change. Good for you. Take care of yourself, and I'll see you next time. See you later, honey.